All right. Thanks for joining us once again, everybody. I am Josh Corman with the International Spa Association, and we are really pleased to be joined again, once again, by Dr. Brent Bauer and Dr. Nadir Bhuiyan with the Mayo Clinic. Our first video, guys, was really popular. You guys did an excellent job. So there's The Godfather 2, there's Empire Strikes Back, and then there's this interview. This is the sequel that goes right in line with those. I just want to kind of jump right in. The last time that we talked, the country really was still in the early stages of dealing with, what do we know about the virus? What do we not know? How do we protect ourselves against it? And, spa owners and operators are really working through that stuff, but so is everybody else. Are we, all these months later, are we essentially still in that same place of these are the precautions you need to be taking: hand washing, wearing a mask? Are we basically in the same place about, what we know about the virus, or has that evolved at all?
I mean, we certainly, know more about the clinical manifestations of this virus and who gets sick and who doesn't. And I think we're much better at treating it in the hospital than we were before. But in the state that things are, especially in this country, none of those recommendations are going away. And in fact, I would say that for individuals such as people that work in spas that are going to be in close contact with patients, would add the recommendation of eyewear or face shields, because there is some evidence coming out that masks plus protective eyewear or face shields protect better than masks alone, even if both individuals are masked. So yeah, nothing I would say has changed. I would just add that to protect the workers that are going to be in very close contact with individuals and customers.
Yeah, I think that's actually, in a strange way, it sounds strange, but it's reassuring to hear. I know that in a lot of our conversations with spa leaders, they have been doing that. They've been trying to exceed, not just meet the recommendations. They've really been trying to go beyond. They've been enthusiastic about adding those extra layers of protection because of exactly what you said, not just peace of mind. They want to put their staff in a position to be comfortable and feel safe, as well as the guests, which is obviously, such a big part of this equation for business owners, of any stripes. And so, so far, I think spas have been taking those precautions. They've been really, really upfront about it. And I feel like we're hearing a lot of successful reopening stories. Capacities are still limited. And we know that, as far as that goes, the financial side is going to have to catch up. But as far as what they can be doing, it feels like people have embraced this and that there has been success. Do you feel like that is kind of an indication that we have been doing things right, at least in this side of the industry, if we can report that, people are feeling comfortable and not running into a lot of spread and transmission in spas?
Yeah, no, I think that's definitely true. And I think it helps businesses when the local governments support universal masking, because one of the biggest challenge I think anybody that's trying to run a business is people that don't want to comply or feel that it's unnecessary, and that may affect your business, and you're put in a situation where you have to think economically, but you also have to protect not only your staff but your customers as well. So when you have local governments that support you, I definitely think that that helps. And we've seen, at least in healthcare institutions where they've implemented universal masking, that they've seen that the infection rates in their own staff have gone down. So, some people are able to successfully reopen. Dentists are a good example because they're probably among the highest risk individuals because of the nature of the work that they do and the fact that it generates quite a few aerosols. And, they have been able to open safely, with the restrictions in place, with people continuing to wait in their cars and not stacking together in the lobby, and screening them for symptoms and things like that. So I think it's possible to continue and to expand to a certain degree, but not to relax on the restrictions, because the numbers are not going away. They're still spiking in certain areas, and I imagine with schools now starting to reopen and college students returning to campus, you're already hearing of elementary schools shutting down because of quarantines, middle schools shutting down, colleges trying to have in-person classes and then switching to completely virtual because of the numbers that they were seeing within the first 2 weeks or week of reopening. So I imagine that trend is going to lead to higher numbers again. So I would not, want anybody to relax their restrictions.
Yeah, and I do want to come back to that question of timeline and looking ahead a little bit in just a moment. But Dr. Bauer, I'm going to turn to you for just a second, because along with, obviously on the front end with spas, there's all this concern about what can they do to make things safe. On the guest side of things, on spa goer side of things, one question that spas are receiving a lot, I think, are from people are about their immune systems and about things that they can do to to take care of that, do whatever they can to put themselves in a position to, in addition to all the other precautions, just be as healthy as they possibly can, given the general climate. So, spas obviously are, are places that are about wellness and about, providing those sort of alternative ways to work with traditional medicine to make people healthy. But as far as immune system, we know getting rest, we know nutrition's a big part of it. What can spas do and spa services do to sort of help people out in that immune system category that they have so many questions about?
Yeah, it's a huge question. It's probably one I get almost every day. Somebody, media, newspaper, how do I get my immune system stronger? What can I do to boost my immune function? And I think it comes back to what you just said. It comes back to how do you optimize health? And we know from a lot of different studies, it's the nutrition, it's the whole foods, more plant-based, it's daily exercise, it's mind body, at least 30 minutes a day. Many studies say more. It's that social connection, it's the good sleep hygiene, it's honoring your spirituality. So if you think about all those things, if we do all of those, actually those are some of the same lifestyle effects that have been shown to increase telomeres. So we know from a genetic standpoint, we can actually see modification of our genetic health with those. So when somebody says, should I take a supplement? Should I take this medication? The first job is always to come back to those lifestyle elements. And if you think about it, many of those are often delivered, taught, provided in some other way, manifested through spa. And so I think the example of the dentist that Dr. Bhuiyan just mentioned, if you think about, I'm not going to go to the dentist to protect my health, then we often see a lot of advanced dental problems surfacing. And I think that's sort of the same problem with the lockdown. If we stay locked down forever, we're now starting to see alcoholism, drug abuse, child abuse, domestic violence. So there's a double-edged sword. And I think if we approach it with the same rigor that the dentists are, we want to bring these patients, and not patients particularly, but participants, back to the spa for all the reasons that spa can be helpful in boosting immune function, helping restore health. But we want to do it in a way that doesn't put the staff members at risk, and we don't want to put the patients at risk.
I think that kind of blends well with what Dr. Bhuiyan was just saying about, putting people in a position where they can come back, they can get back into spas in a responsible and
Right.
safe way, and that those benefits, are there as long as we don't take our, I guess, foot off the gas is the wrong metaphor here. The foot on the brake maybe is the right one. But, even if we start to see numbers decline, we start to feel a little bit better about it.
Yeah.
That's not a sign to change the way that we're handling things like our immune systems and our hygiene and our attention to masking and things like that, because it's really not going to be gone until it's
Right.
gone. We're still in this for sort of a longer time period. So to kind of go back that direction a little bit, Dr. Bhuiyan, you mentioned earlier that we can't let up, and I think that is something that spas, and spa goers have questions about still, is looking ahead. And I know that nobody can predict the future. Trying to do so with this virus particularly seems like a fool's errand. But it's probably safe to say that these kinds of precautions are not the sorts of things that we're looking at a month or two ahead. We may be looking at really being, kind of intense about these kind of precautions in settings like a spa going forward for a considerable period.
Yeah, absolutely. I do think at some point we'll have some return to our normalcy that happened before this pandemic really started to, affect all of our lives. The whole world is trying to find a vaccine, right?
Mm-hmm.
We're trying to make one. Several industries in the United States, World Health Organization, major industries in almost every country you can think of are trying to do it. And it's probably been some time since we've seen this kind of global effort to find, a fix for this solution. It may not be a perfect, but at least to get us back to some form of normalcy. The flu vaccine works. It's not always as effective as we'd like, but it certainly reduces hospitalizations and people getting sick, so much so that we don't necessarily ask people to do these things during, a flu epidemic, right? So, I do have hope that we will get one soon. How long is it going to last? How effective is it going to be? Those all remain to be seen. I would be surprised if we got one before 2021, but I would happily be surprised if it happened. But even with that, I think we're in the long haul here. And it's all about protecting yourself and the people around you, especially the people that are vulnerable to this. And I don't think we should let up. We should expect that this is going to be our new normal until we get a better handle on this thing. When SARS first happened, it kind of just dissipated. And it doesn't seem like that's going to happen with this SARS-CoV-2 called COVID-19. This one seems like it's here to stay for some time, especially with the numbers continue to spike anytime any type of restriction is laxed and people mass gather. Graduations happened recently, 4th of July happened, Labor Day is coming. We saw spikes after every single one of these birthdays. Any type of family, even small family gatherings, increase the risk. So, from everything I've seen from the end of March till now, we absolutely should not and cannot take our foot off the brake, as you said. We have to keep this going forward. I've seen the economic struggles and the impacts that it has on people. And, some of these businesses, it's crucial that they're adapting, and many people have adapted to this, like dentists, like we mentioned. We had to make our own changes to be able to bring patients back safely. But, there's this second pandemic that's going to come from delaying care, like Dr. Bauer alluded to, the people with chronic medical conditions, psychiatric conditions that are not going to get care because they're afraid of this virus. And then they're going to get to a point where there's no choice but to get care. Then they're going to flood, the healthcare infrastructure. And if there's an, overarching theme about, boosting your immune system, and some of the strategies that Dr. Bauer was talking about is, stress negatively impacts your immune system. There's studies that have proven that. And, when you think about spas, if you zoom out, spas are all about stress relief. Really, it's about self-care, mindfulness, relaxation. And if you can do that for somebody and you can reduce the stress, because make no mistake, this is stressful times for everybody, that can actually help their overall health and their immune system. So, in a way, you can say that any type of service that you could provide to somebody that can reduce their stress could be seen as critical, especially, what's going on. And we have to adapt. Everybody has to adapt. I mean, it's, I'm a basketball fan, and Pat Riley likes to say adapt or die, right? So I think that that definitely applies here. So, that's what I have to say about that.
No, I think that makes sense. And I think that, when we come back to spas, spas are in positions where we've seen just geographically where they are and what restrictions are in place where they are has, fluctuated wildly. Two people, operating, even spas under the same brand are doing so with different restrictions or different guidelines sort of being handed to them. So it sounds from what you're saying, like spas, are among the groups that should be thinking, let's go ahead and maximize, let's keep the, as restrictive as we can be while remaining open and still having guests be a part of the spa experience, that they really do need to take those steps, even if they're, restrictions or guidelines are maybe not as stringent as they are in other places, that spas should assume that they need to be in that kind of upper level of precaution still at this point. Dr. Bauer, I'm going to turn back to you because something Dr. Bhuiyan said kind of sparked this. Right now, I think a lot of people, we've heard that demand has been pretty strong in some places with spas because after the shutdown, people were eager to go back in and get that stress relief. They were eager to go back and have that human connection a little bit, and that even that social aspect of the spa experience. And I know that right now, not everyone is going to feel comfortable going back into a spa, whether it's because they're at a high risk category or because of age, they just may not feel comfortable. What kind of guidance or advice can spas give to those guests or members who they still want to be connected with and they still, want to offer that wellness and those solutions to those guests, but they might be having to do some of that stuff at home. They might be on their own trying to supplement some of their traditional spa routines. Can spas kind of help guide that process for some of those guests?
Well, I think absolutely. I mean, I've always thought of spa as high touch, and I think that will always be a hallmark for spa. But high touch can go along with high tech, and obviously, we're doing a Zoom meeting, which was relatively unheard of, at least on a common scale, just a half a year ago. And look how now this has become ubiquitous. So I think the same thing. We're seeing a lot of spas produce or share really nice high tech offerings, whether it's a stress management, a mind body, a guided imagery, online Tai Chi classes, online yoga classes. So I think the tech part, how do you marry the high touch, the high tech? When we can't have the high touch, we're going to rely more on the high tech. But spas are well equipped for this. Many had already offered a lot of things electronically, converting some of the things that are on site into something that can be delivered across the internet is not a huge lift. It's always a challenge for smaller spas, but I think we have a tremendous number of resources in every spa, and they're unique. So I think this is a great time to look at those resources, ask yourself critically, what do we have? How do we translate that into a high-tech approach while we still honor the high touch that is a hallmark of spa?
Yeah, necessity is the mother of invention, right? And we've
Yeah.
we've seen it. We have heard some amazingly creative solutions from spas for ways to reach their guests. Even if they can't be within the four walls of the building, and even if they can be, trying to be creative about how they can perform services and treatments that maintain that high level of safety. One other thing as we approach the end of the year, when we first talked, it was spring, and there were some hopeful conjecture maybe about summer and the positive effects it might have on the virus. And as Dr. Bhuiyan mentioned, we've seen some big gatherings and things that have kind of thrown that for a loop a little bit. But as we approach, flu season, which you mentioned before, people are going to be presenting as sick. They're going to have symptoms that may not have anything to do with COVID-19. But that presents a real challenge because screening for health and asking people questions before they come to the spa has obviously been a big part of the safety precaution. Is there advice or guidance that you can offer spas about that side of things as you approach, flu season and the idea that winter, sets us up for a new set of challenges as far as the virus goes?
Yeah, no, definitely. So I think the systems that many places have in place, the questionnaires, the temperature checking, the please wait in your car until it's time for your appointment, that's going to protect from COVID and flu. So I see no reason to change those things, because even if somebody triggers flu symptoms and they don't have COVID, that person shouldn't be coming to a spa anyways, because flu is also highly infectious, right? And it's the same groups that are at risk. But we do have a vaccine for flu. And this is just another time to reiterate the importance of vaccinations. And for the directors of the spas to encourage your staff to get the flu shot as well, to protect themselves and protect the customers. And if it's reasonable or possible to work with local organizations to make it easy for customers, staff to get their flu shots, I think that's a great thing to do. Because if you get your flu shot and you feel sick still, yeah, it's possible you still have the flu, but in the pandemic that we are, and now we might be more concerned about COVID-19. So I think if more people get the flu shot than previously, it will help to some degree offset that dual concern. So, that's what I think, should be recommended. Obviously, you can't force vaccinations on people, but, it should be highly encouraged that people that work in spas get their flu shots, and sending out for like a wellness email to encourage your customers to get their flu shots too, because they're likely going to coexist and you can probably get both at the same time, which doesn't sound like fun. And that's probably what I would say about the coming flu season. Winter, people are going to cluster together, stay indoors more. Is it going to spread more? Is it going to spread less? I think that remains to be seen.
Yeah, that gets back into the predicting the future game, which we won't try to do here. But I think in that way, spas can actually be kind of their own like mini public health advocates by talking about the flu shot, by advocating for wellness in their staff and in their guests as well. Because it is interesting, it's not something we've thought about before. Oh, it's flu season, we all have to wear masks now when we go inside. But that may be one of those things that long term ends up actually being a positive outcome, is that people are more mindful about infectious disease in general and about spreading and transmission of those. So taking some of these precautions, as frustrating as it has been for many people up to this point, ends up serving a purpose that could be really valuable long term. And on that kind of subject of silver linings, we'll sort of hopefully walk away on a little bit of a positive note. As we look at all this, I mean, that's one example maybe where spas can play a role in encouraging good health practices across the board, whether or not they're related to COVID, and kind of fulfilling part of their mission that way. Are there, as healthcare providers, as people who are involved with patients and really kind of seeing this at the ground level, are there silver linings for both of you that you kind of take away going forward from the situation we're in now?
Yeah, and I think Dr. Bauer kind of alluded to it, how nobody understood or knew the applications of Zoom until, less than half a year ago, and how ubiquitous it is. I mean, I think the same thing is true for telehealth. It was always coming, it was always going to happen, but I think this pandemic jump-started it even more than people were expecting, and made it easier for both patients or customers or clients and healthcare providers and people that work in the service industry to connect with each other in a safe manner. And I think that's definitely not going away, even if we get a handle on this virus with an effective vaccine. I think that's here to stay. And I think if you look at the world that we live in, whether you agree with it or not, people have different expectations for services they're looking to obtain. I mean, you can order a personal taxi by clicking a few buttons on your phone. It'll take you wherever you want to go, right? There are apps for telemedicine now that you can do directly through your phone. You can have groceries delivered to your front door by using your cell phone. And, so I think people are going to come to expect that from other avenues, and that may, include spas as well, that there's going to be some kind of telespa, mindfulness, or instructions on how to apply certain products or techniques on yourself at home where it's safe. And I think that's a good thing because not everybody has time to go do these things, but if they can have increased access or based on where they live or they currently are, I think it's going to be beneficial for everyone. And I also think it increases job opportunities for individuals, because you might be able to work for a company in a different state or even a different country without relocating fully, which allows the companies or institutions to acquire a broader range of talent outside their local area. And it allows people to seek out opportunities without having to completely relocate. I think all of those things are going to end up being positive for the future, and I don't think those things are going to change.
No, I hope people are listening for business insights from Dr. Bhuiyan. You're right. I think there is this, looking forward, as I said, necessity is the mother of invention, and we're finding, creative solutions to a problem we wish we didn't have, but that, going forward, when that problem is sort of set aside, the solution still can kind of carry us forward. Dr. Bauer, silver lining for our current situation looking ahead. I know that you're a positive person, so I'm ready for this.
No, I'm very positive. I think, the tragedy of the coronavirus is we don't have a good answer from a medical perspective. And so whereas if I think of the average spa goer, probably 10, 20% of the population, very focused on health, right? They go to spa, they understand this, they do the nutrition, the exercise, they know mind, body, stress management. But I would say 75, 80% of Americans pre-COVID lived a life that said, I'll do what I want. I don't have to worry too much. If I get in problem, medicine will be there to fix me. Put in my stent, I can survive my heart attack and so forth. And that's oversimplified. But I think what COVID has done is it's reinforced the concept that medicine is great at fixing many things, but we can't fix everything. And so there are things that we should really focus on preventing. And COVID happens to be one of them. That's what we're talking about, boosting the immune system. But now instead of having 20% or 25% of the population asking questions and trying to optimize their health, it's almost ubiquitous. People everywhere are saying, how do I help my health? I can't rely on medicine to find the cure tomorrow. If I get it, I probably don't have a great immediate solution from my medical team. I better look deeper. And that deeper is where we come back to, let's focus on the nutrition, the exercise, the stress management, spirituality, all those things, which spa, I think, has been at its core promulgating for the last several centuries. And now it's coming up in a very different way to a lot more people than ever would have asked that question before. So again, being cautious not to say that there's something good about coronavirus, but if we're looking for that silver lining, I think it reframes our questions and our priorities from pre-coronavirus. A lot of Americans, we were just running like rats, chasing the next bigger thing, the house, the stuff, and all of a sudden we had to hunker down. We've refound the value of family. A lot of people reconnected with their faith, and I think a lot of people are emerging with a much different focus on, rather than trying to run the rat race, how do I, first of all, care for myself, care for my family? And maybe there's this greater now recognition of how do we care together. And if that emerges and persists, that could be transformative for the world. And that could be a real nice silver lining.
I knew that you would come through with a positive takeaway. Absolutely. But no, I think that, you know, we have seen spa people, spa professionals, they've been raising their hands since this started, saying, you know, we do have, you know, access to things that, like you say, can be preventative, that people can do to boost their wellness on the front end, and just holistically take care of themselves a little bit more than, as you said, that they might have been previously. And so, you know, if people will take them up on that, I think the spa industry is ready and willing to be creative and to really lean into that, and hopefully help them, you know, connect some of those dots, and you know, the greater attentiveness to wellness can't be a bad thing long term. Let's hope that is one thing that carries on. Thanks to you both again for joining us, and you know, I think that there is so much information swirling. It is, you have to keep your head on a swivel just to keep up with each, you know, each new development. And so I think that having a chance to sit down and really, you know, dive into some things, especially the spa specific stuff, our audience is really going to respond to that. So thank you both again. You can catch, if you didn't see the first installment to this beautiful sequel that we've just completed here, that's available on iSpa's YouTube page, along with all the other virtual events and other interviews that we've been doing recently. Our COVID-19 info page, our reopening toolkit, all the good resources that we have there at experienceispa.com. You can find those. Thanks again, gentlemen. Best of health to you both, and good luck as you go forward navigating the complicated world of medicine at this moment in the time of COVID.
Thanks, Josh. Be well.
Thank you.